There's a multitude of articles on the benefits of happiness and how to get it. There's over 1,000 books on the subject and just as many scholarly research articles and papers. Many of the things that you see are simple listicles and clickbait to get you to buy some new thing to increase your happiness. And it makes it look so easy. But that advice, like telling a sad person to think about all the reasons they have to be not sad, or a depressed person to just get up and exercise, it doesn't work. Thinking about good things in life can sometimes lessen sad feelings, but usually trying to grasp at happiness when in the grip of a depressed mood leads to failure. And while the research on exercise's positive effect, for instance, on depression, is robust and persuasive, depressed people often lack the drive to work out. That's what depression means. It's a lack of drive. These suggestions, though well meant, amount to telling a depressed person to snap out of it. It's their fault. This shames the sufferer, making things worse, and the resulting family strife doesn't help. Well-intentioned spouses and partners who believe that snapping out of it actually is within the depressed person's power will eventually succumb to exasperation and resignation, and they'll want to give up on the depressed person. Even popular speakers and writers have suggestions for eliminating negative thinking, such as it might be helpful to ask yourself if you're accomplishing anything by dwelling on your negative thoughts. Now, if you have ever been depressed or know someone who has, that suggestion is simply ludicrous. Depressed people have negative thoughts. Understandable. When we're depressed, we're likely to feel hopeless, inadequate, and like a failure. So that advice makes you feel more like a failure. So while practicing things like mindfulness and controlled breathing and all these things that these advice givers give, well-meaning, it's difficult for someone who becomes clinically depressed to integrate those into their daily life. Sometimes it's impossible to follow well-meaning suggestions with any regularity. It's like New Year's resolutions. Those techniques fade quickly. Often, sadness is normal. Experiencing a range of feelings in reaction to painful life events is understandable. These life stressors would make most of us depressed. When psychologists see a client for the first appointment, we will assess mood, its duration, and the severity of the distress. And if the client's symptoms are within normal limits, given the precipitant for entering therapy, so that might be a marriage crisis, job loss, death of a family member, a pandemic, let's say, we would say that their feelings are within normal limits when they came to therapy. And when they come to therapy with sadness, after losing someone they love, we would also say this is normal. We wouldn't give you a diagnosis of depression. So just like we wouldn't tell someone they're anxious because, well, the world is upside down right now with the pandemic and the latest turmoil over police brutality, we would see those depressed and angry feelings about this as completely normal and understandable with empathic and appropriate responses. It's hard to feel deep emotional distress. Indeed, because suffering is part of the human condition, we've devised a vast repertoire of ways to avoid experiencing our painful emotions and our worry thoughts, including self-medicating by substance use, distraction by Facebook and other social media outlets, online shopping, and much more. Americans account for 2/3 of the global market for antidepressants, which also happens to be the most commonly prescribed drug in the United States. These drugs can play a really vital role in helping people cope with chronic depression and even other kinds of depression. But all too often, these medications are overprescribed or prescribed without really looking at inner sources of distress and depression. Accepting suffering as unavoidable is key to learning to be with the sadness and being with difficulty rather than running away from feelings. Of course, a clinical depression must be treated by someone knowledgeable in diagnosing and experienced with this treatment, but know that suffering and sadness can't be avoided. It's the first noble truth in Buddhism. Allowing ourselves to express sadness and accept deep pain will eventually allow those feelings to dissipate. But blocking emotion only deepens problems. Also, giving ourselves time to settle into feelings allows us to recognize that they do ebb and they do flow, and through this we can accept that while these difficulties are inevitable and feeling sad is part of living, suffering is impermanent. By being able to sit with emotions and not get caught up in either rumination or anxious fretting, we develop a steadiness of mind. Meditation is one thing that works by settling our turbulent thoughts and emotions so that we can titrate them into tolerable moments. Titration is a term used by chemists and pharmacists. It means that we can only take something in small amounts until we can tolerate it, like starting a new medication, for instance, on a low dose and then building up, or not going out the very first day you get a new bike and riding uphill and dale all in one day, first out. No, start small, build up. And it's the same with sadness. When sadness becomes a major depression, positive thinking and related approaches, such as some types of coaching, are like putting a band-aid on a gushing wound. Facing our pain, learning to bear our suffering, and then doing the deep inner work of understanding our role in our troubles is a way out. It's also looking at all the factors that go into our sad mood and understanding them with a kind of insight. And then we can begin to look at what are the obstacles. So here are some steps in the process. The first is become aware of subtle emotions as you experience them. By becoming aware of emotions as you feel them, rather than pushing them away, you'll be better able to employ coping strategies. And then the second important step is when emotions become intense, know that feelings don't stay that way forever. All emotions are transient. They will pass. Practices such as regular meditation help us not just become aware of feeling, but also not to be too attached to those feelings. And that's a really important skill to develop. And it takes time and it takes practice. And you probably want to work with someone, at least in the beginning, if you feel like your sadness is becoming overly sad and you think you might be moving into a more clinical depression. So think about the ways in which sadness is part of life. Think about the ways that it's been there from the time we were born all through our lives. And think about ways that you can begin to build a kind of titration for those feelings. And then little by little, hopefully, you can begin to employ some of the things that will begin to help you cope. See you next time.